Assalamu alaikum dear doctors. In this video I am sharing differential diagnosis of abnormal movements or seizures in neonate. Remember, abnormal movements or seizures in neonate. First diagnosis is infections. These are septicemia, meningitis, encephalitis, toxoplasmosis or cytomegalovirus. And the tests to establish this diagnosis are blood cultures or CSF study. I am again repeating, diagnosis is infections and these are septicemia, meningitis, encephalitis, toxoplasmosis or cytomegalovirus. And tests to establish the diagnosis is blood cultures or CSF. Next diagnosis is metabolic disorders. And the disorders are hypoglycemia, hyponatremia, hypernatremia, hypocalcemia, hypomagnesemia and inborn errors of metabolism. And the tests to establish these metabolic disorder diagnosis are blood glucose, electrolytes, magnesium, calcium, metabolic screen, urine and plasma. I am again repeating. Diagnosis is metabolic disorders and these are hypoglycemia, hyponatremia, hypernatremia, hypocalcemia, hypomagnesemia, inborn errors of metabolism. And tests to establish this metabolic disorders diagnosis are blood glucose, electrolytes, magnesium, calcium, metabolic screen, urine and plasma. Next diagnosis is intracranial hemorrhage and the test to establish intracranial hemorrhage is head ultrasound scan. I am again repeating. Diagnosis is intracranial hemorrhage and test to establish intracranial hemorrhage is head ultrasound scan. Next diagnosis is congenital brain malformations and test to establish congenital brain malformation is CT or MRI scan. I am again repeating. Diagnosis is congenital brain malformation and test to establish congenital brain malformations is CT or MRI brain scan. Next diagnosis is infantile spasms and for establishing diagnosis infantile spasms test is EEG, electroencephalogram. I am again repeating. Diagnosis is infantile spasms and tests to establish infantile spasms is EEG. Next diagnosis. Next diagnosis is benign neonatal seizures and test to establish the diagnosis is EEG. Again repeating, benign neonatal seizures and test to establish benign neonatal seizures is EEG. And the last one, pyridoxine deficiency. For pyridoxine deficiency, established diagnosis test is therapeutical trial of pyridoxine. Again repeating, pyridoxine deficiency and test to establish pyridoxine deficiency diagnosis